the minimum distance from the device to body is 20 centimeters, about 8 inches. Children using mobile phones. There are many potential health risks to mental and physical well-being related to overuse of cell phones, especially low IQ and improper mental growth in children. Sleep deprivation, brain tumors, and psychiatric diseases are hot-button issues. Till date, studies related to radiations generated by mobile phones have been inconsistent, and results have been conflicting. These wireless devices are now part of our everyday life, but they can be used in a manner that is safe enough. The most important point is the distance. Holding a cell phone few inches away from our ear provides 1,000 times reduction in risk. Unless a cell phone is turned off, it is always radiating, so when not in use, it should not be kept on the body. The best place to keep a cell phone is somewhere like a pouch, purse, bag, or backpack. These devices should be kept away from a pregnant woman's abdomen, and a mother should not use a cell phone while breastfeeding and nursing, and baby monitors should not be placed in an infant's crib. Children and teenagers need to know how to use mobile phones and wireless devices safely. Cell phones should not be permitted in children's bedroom at all. Can cell phones cause cancer? In fact, there are solid grounds to believe it really is so. The cause for that is radio frequency of electromagnetic fields given off by wireless and mobile devices. They have an adverse effect on our body, especially on growing skulls of kids, toddlers, and teenagers, which can trigger the development of brain cancer in the future. According to a recent research conducted by the International Agency for Research on Cancer, excessive use of mobile phones may lead to the formation of brain tumors as glioma and acoustic neuroma. Fur.
हेलो व्यूअर्स, वेलकम टू हेल्थिस्तान यूट्यूब चैनल। दोस्तों, अगर आपने हमारे चैनल को सब्सक्राइब नहीं किया तो चैनल को सब्सक्राइब करें और बेल आइकन पे क्लिक करें।